And give the call to the honourable member for Cunningham.
Thank you, Deputy Speaker, and I'm very, very pleased today to second this motion by my colleague on the crisis in aged care, and I want to talk to the House about 3 ways in which that is having a very real effect on older people in my electorate at this very moment. First is obviously the issue around home care packages. I've had a lot of families contacting me in great distress because their elderly relatives have been assessed as needing a high-level care package, and they have been waiting months, some up to a year, to get that service. Now, I ask people to imagine what that means in reality for those families. They have an elderly family member living at home. They are trying to support them, and at the same time they've been assessed as needing a package and they can't get it. What that means is those families are stepping in, trying to provide that support to their elderly relative, often when they're managing their own work life, children and so forth. And I've had people in tears because it's really awful. They feel terrible complaining about having to support their elderly relatives, but the pressures on the family are enormous. So before the budget, it seemed that from the stuff leaked to the media that we're going to see some big initiative. What did we get? 14,000 measly places across 4 years across the whole country, when the government's own figures showed over 100,000 people across Australia are on these waiting lists. It is an absolutely critical issue the government needs to get serious about addressing. The second aspect, and what became obvious from the budget, was that the funding that was provided for those 14,000 places wasn't new money, it was coming out of residential care. And I can tell you residential care needs more investment, not less, at this particular time. Just the other week, I attended a forum in my electorate organised by the Health Services Union as part of their campaign for better aged care services. And I just want to acknowledge the speakers who were there. Gerard Hayes from the Health Services Union himself spoke, but we heard from 4 just amazing aged care workers: Amanda Hampton, Karen Singh, Lisa Walker and Lynn Martin. And their love of their job, their dedication to the people that they work with was one of the most inspiring things I've heard, and it was really well received at that forum, because people understand, particularly if you've got elderly relatives in residential care, that these people at the front line are the love and care and protection that they would expect, we would all expect, for our elderly relatives in aged care. And they were talking about the pressures and stress they're under around issues of funding and staffing and quality care, and their cry out for more care from government to make sure that those services are offering the dignity, respect and quality of life that our older Australians deserve. And I tell you what they don't deserve. They don't deserve to have their work undervalued. It's not good enough, as the Prime Minister said in question time last week, to say to aged care workers that what you should aspire to is to either get a better job or move up to management. The reality is we should respect and honour the work that these workers do day in and day out, looking after our elderly with love and care and compassion and dedication. And I would suggest to the Prime Minister that he rethink what he said, and maybe make a clarifying statement about the fact that that work is important and we value it. We've got a shortage of aged care workers. We need to be backing them in. The third aspect in my electorate that's having a real effect on older people is the decision by the Department of Human Services to cut the Warrawong Centrelink Medicare office. There's a report out today by Anglicare Australia talking about the impact that the loss of face-to-face services in Centrelink is having on vulnerable people, and that includes our older Australians, particularly the fact that the increased automation is making it a much more stressful experience. Hank Yongan, speaking on behalf of the department, said that they recognise that not everyone wishes to or can access digital solutions. That's absolutely true. And I would call on Mr Yongan, in the spirit of his comments to the media today in response to the Anglicare report, to review the decision to close the Warrawong office, which is right in the heart of the communities that are very disadvantaged but also have very high populations of elderly people from a non-English speaking background who need to have a Centrelink Medicare office that they can go in and speak to someone face to face and lodge their documents. So on those three aspects, there are real issues for older people in my electorate. We need to get much better at servicing them.